Dear friends, I am Dr. Ikshita, consultant gynecologist, and you are watching Women's World 58. In the last episode, we talked about the problem of vaginismus, its causes, and how a gynecologist diagnoses the condition. Now, in this episode, we will discuss about various methods to treat this vaginismus and also the treatment for other reasons of non-consummation of marriage. Now you will ask me, what is a big issue? If a couple is not able to perform sex, let them be like that. Why do you want to treat it? Friends, sexual act is very important for physical and mental relaxation of humans. This act brings about release of certain endocrine chemicals which are known as pheromones from the brain, certain areas of the brain, and from there these pheromones are circulated in the body, which makes us happy. We have a positive feeling, we are relaxed, we have good appetite and good sleep. And also this act brings a bonding between the husband and wife. Those couples who are not able to perform sexual act are really miserable. They suffer from lack of sleep, irritability, problems such as decreased appetite, acidity, stress, anxiety, depression, and strained relations between husband and wife. And so, dear friends, it is very important for the couple to reach the gynecologist to get help. Now, how do we go about it? Now, when a couple comes to me with this problem, first I examine the wife to rule out certain anatomical problems in her due to which she may not be able to perform the sexual act. Now, what are the anatomical problems? See, if you see this picture, there is hymen with a partition inside, that is known as septate hymen, and there is another hymen which has holes in it like a sieve, and this is called as cribriform hymen. Now, these two types of introitus, the menstrual blood can be discharged through these apertures, but husband will not be able to penetrate and perform sexual intercourse. The treatment of these two problems is separate, which I will discuss at the end of this episode. So once I find out that there is no such problem in this patient, then I take her out of my examination room, make her sit in front of me relaxed and start counseling, because the treatment is counseling and counseling. I talk to her in many visits. She has to come to me after a few days again and again, and I assure her that there is nothing wrong in her body. She will be able to tolerate the pain with my help. I give her examples of other married friends of hers who have children and who are happy in their married life. I tell her jokes, I make her laugh, and I develop this confidence in this woman that I can do it. Now, after a few visits, I realize that now she is ready to try to have intercourse. In that condition, then I prescribe her some exercises so that the muscles surrounding the vagina will relax. Now, what are the two very useful exercises amongst these? Now, one of the exercises, a deep squat, in which she has to hold a table or the countertop in the kitchen with two hands and then separate her legs on either side shoulder width, and then she tries to squat as deep as possible. Stay there count 10 in her mind and then get up. Again she sits down, squats hard and again counts 10. And this exercise she will do 10 times in the morning, 10 times in the evening. Then slowly every third day she will increase it to 15 times, then 30 times and like that. Another exercise I advise is pelvic drop down. Now what is this pelvic drop? She will sit on a chair or she will sit on the floor and she will take deep breath and try to push her pelvic floor as if she is straining or she is defecating. She will try to push it very hard to her capacity and then she will exhale, relax, again she will breathe in and try to push the pelvic floor as low as possible. After she does these exercises every day for about a month, I call her back and again I try to examine and see whether she allows me to put her finger inside. Now if this has helped her, well and good. And then I advise them to try sexual intercourse. But if this has not helped her completely, then I prescribe her the next method, that is dilatation by herself. I write an anesthetic jelly which acts as a lubrication and also pain relief. She will apply that jelly on the little finger and try to push it through this opening slowly and slowly, and she will also apply the jelly at the opening of the vagina. So 5 to 10 minutes this area becomes pain free, it becomes numb and then she slightly tries to enter. After 3 to 4 days then she will put it on 2 fingers and try to push 2 fingers. Now once she is able to put 2 fingers, I ask her to stretch them. So this whole process will take about 3 weeks to 1 month. And with every time she stretches the fingers, the opening of the hymen becomes big and that fear of pain is gone. If she is scared to use her own finger, then there are acrylic or plastic dilators which are available in increasing size for smaller to bigger. So she starts with the smaller dilator and goes higher up every 3 to 4 days. She will apply again the ointment, the anesthetic ointment here, and then she will apply the anesthetic ointment on the dilator and try to push it through this opening. If she is scared to do that, her husband can also help her in doing that. And once she is convinced that this act is painless, then I ask her to go ahead with her experiencing the sexual intercourse. I request them to take bath with warm water, eat their dinner early, put a blue light in the bedroom, then play some romantic soft music. Then she will apply some amount of anesthetic ointment at the opening of this introitus and then he tries slowly to penetrate. Daily, little by little, more and more inside. And at the end of 10 to 12 days, they are able to have the actual complete penetration and the sexual act. Once they are able to do that, I advise them to do it every day for at least 1 to 2 months till the vagina dilates and the hymenal opening also dilates. Once she experiences the pleasure of sexual act and the pleasure of foreplay and the orgasm, she is excited with the thought of having sexual intercourse. So her vagina becomes lubricated, she has good amount of secretions and the pain is completely gone, the fear is completely gone, and then they live a happily married life. Now in short, we will discuss about the anatomical treatment of anatomical problems. As we saw that some ladies may have this partition in the hymen or this cribriform hymen where there is a plate here, they have to undergo a small surgery in which this portion of the hymen is removed surgically by giving them anesthesia, and then this hymen is opened up, and in within 10 days this wound heals, and then they are encouraged to have intercourse. Sometimes this opening has a ring of fiber, and because it is a fibrous ring, even putting inside a finger or the dilator does not open the hymenal opening. In these patients also there is a small surgery done in which this ring is cut and the hymen is opened, and then in 10 to 12 days when the wound heals, they are encouraged to have physical relations. So friends, that completes our discussion regarding the non-consummation of intercourse due to female causes. I hope this has cleared all your doubts. It has removed all fears from your mind. Please share it with your friends who are newly married or friends who are going to get married. And please subscribe my channel so that I am encouraged to make more videos with newer topics. We'll meet next time with an interesting topic. Until then, stay happy, stay healthy, take care of yourself. Thank you.